Good day, everyone. Today, our topic is all about healthcare policy. For our learning objectives for today, after completing this session, students will be able to, number one, understand and define policy and health policy. Number two, recognize different types of policy. Number three, outline the stages of policy making process. Number four, summarize the process of policy becoming law. And number five, we're going to examine the role of healthcare leaders in policy advocacy and implementation. Why is health policy essential in managing the business of healthcare? Understanding health policy is crucial because it sets the rules and guidelines for how healthcare is delivered, financed, and regulated. It impacts decisions about costs, access to care, and the quality of services which directly affect healthcare businesses. Knowing these policies helps healthcare leaders, administrators, and managers navigate challenges, comply with regulations, and create strategies to provide efficient, patient-centered care while staying financially sustainable. I would like to start my discussion by presenting to you the triple aim. The triple aim is a framework in healthcare with three main goals. First, better care. This means making sure people get safe, high quality and effective treatment when they need it. The second one is improve health or improving population health, which focuses on not just treating people when they are sick, but also helping communities stay healthy by preventing illness before it happens. And the third one, lower costs. This goal is about making healthcare more affordable for everyone, whenever it's individuals, families, or the entire healthcare system. Now, these three goals work together and policies are created to help achieve them. For example, a policy that funds preventive screening like mammograms or diabetes testing supports all three aims. It improves care by detecting issues early, keeps the population healthier, and reduces costs by avoiding expensive treatments for advanced diseases. Now let us define policy and health policy. A policy is a set of rules or guidelines made by organizations or governments to guide decisions and actions. It's like a plan or roadmap to solve a problem or achieve a goal. On one hand, health policy focuses specifically on decisions and plans about healthcare, like how hospitals are run, how medicines are priced, or who gets access to certain treatments. These policies aim to improve health, make care affordable, and ensure everyone gets the care they need. Policies guide decisions and actions in healthcare, ensuring that care is effective, fair, and organized. They can take different forms, from laws created by governments to informal practices within organizations, all working together to shape how healthcare is delivered. First, we have legislative policies. These are laws created by governments like Congress or state legislature. They set rules for how society should function. For example, the Affordable Care Act is a legislative policy that made it easier for people to get health insurance and required insurance to cover essential health benefits. The second one are regulatory policies. Now, these are rules made by government agencies to enforce laws. They are the details and standards needed to implement the law. For example, the Food and Drug Administration, or FDA, has regulatory policies to ensure that medicines and vaccines are safe and effective before they can be sold. The third type of policies are called organizational policies. These are internal rules set by organizations such as hospitals or clinics to manage how things are done within their walls. For example, a hospital might have a policy requiring all staff to wash their hands before entering patient rooms or prevent infection. The last type of policies, these are informal or guiding policies. Now, these are unwritten or loosely defined practices that guide behavior based on common values or norms. Now, for example, a clinic may have an informal policy of prioritizing patients with urgent needs, even if it is not written in their official guidelines. Policies in healthcare serve different purposes, from creating rules to ensuring fair distribution of resources. Understanding the difference between regulatory and allocative policies helps clarify how healthcare systems are shaped and how they impact individuals and communities. Now, what are the differences between regulatory policies and allocative policies? When we talk about regulatory policies, these focus on setting rules or standards to control behavior or ensure safety. In other words, they're about how things must be done. For example, the Food and Drug Administration requires that all drugs be tested and proven safe before they can be sold. This rule ensures medicines are safe for everyone. Allocative policies focus on distributing resources either by giving benefits to a specific group, we call it as distributive policies, or by shifting resources from one group to another, or we call it as redistributive policies. Now, example for this is that a government program that funds new hospitals in rural areas to ensure access to healthcare. This is an example of distributive policy. Now, Medicaid program takes money and uses it to provide health insurance to low-income individuals. This is an example of redistributive policies. In simple terms, regulatory policies set rules, while allocative policies decide who gets resources or support. Now let's talk about the conceptual framework of health policy. This framework is a conceptual model used to understand the various factors and relationships involved in health policy development and implementation. And this framework highlights how health problems, political systems, socioeconomic norms, stakeholders, leadership, resources, and solutions interact to shape health policy outcomes. Now let's talk about it in a simple way. The health problem represents the issue or challenge that needs to be addressed, like a disease outbreak, lack of healthcare access, or rising healthcare cost. The political system involves the government or political environment which creates laws and rules to address the health problem. Decisions are often influenced by leaders, elections, and political priorities. Now, when we talk about socio-cultural norms, these are values, beliefs, and behaviors in society that influence how health problems are perceived and addressed. For example, cultural attitudes about mental health or vaccinations can shape policy decisions. Now, let's talk about the inner circle. Let's talk about leadership. When we talk about leadership, we're talking about effective leaders who guide efforts to solve health problems by making decisions, allocating resources, and inspiring action. Of course, aside from leadership, there should be resources, which includes money, people like doctors and nurses, and technology needed to address the health problem. In addition to leadership and resources, we also have stakeholders. These are groups of individuals with an interest in the issue, such as patients, healthcare workers, government officials, and community organizations. And of course, the solutions. We're talking about policies or actions that are developed to address the health problem based on available resources, leadership, and stakeholder input. Overall, this framework shows that solving health problems requires coordination between political systems, societal values, leadership, stakeholders, and resources to develop effective policies. Now let's talk about policy cycle, or how policies like those that affect healthcare are created and put into action. The policy cycle helps us understand the process from identifying a problem to seeing the solutions in practice. Now let's break it down step by step. The first step is issue raising, which is when people notice a problem that needs attention. For example, imagine there's an issue with long wait times at hospitals. Here, nurses, doctors, or even patients themselves might start talking about it, realizing that it's causing stress and harm to patient. This could be a healthcare issue that gets everyone's attention. The public, healthcare workers, or advocacy groups start raising their voices to make sure this issue is seen by the government or decision makers. Next comes policy design, which is when experts and leaders start figuring out what should be done to solve the problem. In our example of hospital wait times, a policy might be proposed to hire more staff or improve hospital scheduling. Designers of the policy, like healthcare professionals, lawmakers, or experts, will come up with a plan that will hopefully reduce wait times. They will look at what worked in other places, maybe test out different ideas, and come up with the best solution. The third step is building public support. Once a good decision or solution is designed, the next step is building public support. This is where advocates go to the community, media, and even politicians to get everyone behind the idea. In our hospital wait time example, people might hold rallies, post on social media, or talk to their local representatives to convince them that this is a real problem. And the goal is to get the public support the policy so that lawmakers and leaders will feel the pressure to make it happen. Now, after the public shows support, the next step is legislative decision making. This is when the policy is debated and voted on by the lawmakers, like Congress, or the state legislature. These lawmakers will look at the proposed policy, think about its costs, and decide if it's the right thing to do. In our example, lawmakers might pass a law to fund the hiring or more staff for hospitals to reduce wait times. The last step is policy implementation. It is when the plan is actually carried out. This means that the hospital system will start hiring more nurses, changing how they schedule patients, or building new facilities to handle more cases. This step is where the policy moves from just being an idea to real change on the ground. It's also when we start to see if the policy works. Do the wait times really go down? Or are the patients getting better? Now let's talk about the legislative process. Let's talk about how a bill becomes a law. You've probably heard about bills being passed, but have you ever wondered what happens from the moment an idea is introduced to when it is actually becomes a law? Now, the first step is the introduction of the bill. A bill is simply a proposal for a new law or a change to an existing law. Anyone can come up with an idea or a bill, but it's usually a member of Congress or state legislature who introduces it. For example, if a lawmaker wants to improve healthcare in hospitals, they might propose a bill to increase funding for hospitals. This bill is then formally introduced in the legislative body like Congress or state legislature. Once the bill is introduced, it goes to a committee review. Think of a committee as a small group of lawmakers who specialize in certain areas like healthcare or education. Now, this committee carefully reviews the bill, discuss what it means, and can suggest changes to improve it. For example, if the bill proposes more funding for hospitals, the committee might look at how much money is needed and how it will be used. Sometimes they hold hearings to hear from experts or the public to get their opinions. Now, after the bill has been reviewed and changed, it goes to full debate and voting. This means that all the lawmakers in the chamber, whether it's the House of Representatives or the Senate, get to discuss the bill. Here, they may agree with it, or they may want to change it. After the debate, they vote on the bill. If most lawmakers vote yes, the bill moves to the other chamber, for example, from the House to the Senate, to go through a similar process. The bill now heads to the other chamber. If it started in the House, it goes to the Senate, or if it started in the Senate, it goes to the House. The other chamber repeats the process of community review, debate, and voting. If both chambers agree on the bill, it moves forward. But sometimes, they may disagree and then will need to work out a deal or make changes until both sides are happy with the final version. Now, once both chambers agree on the final version of the bill, it goes to the president or governor for approval. If it's a federal law, it goes to the president. If it's a state law, it goes to the governor. The president or governor can either sign the bill into law, which means it officially becomes a law, or they can veto it, which means they can reject it and send it back for more work. Once the bill is signed into law, it enters the implementation stage or enforcement stage. This is when the law starts to have real effects. Government agencies, local authorities, or departments, like the Department of Health, are responsible for putting the law into action. For example, if the bill is about funding hospitals, the money would be distributed and hospitals would start using it to improve their services. However, if someone believes that the law is unconstitutional or unfair, they can challenge it in court. This challenge may go all the way to the Supreme Court, which is the highest court in the country. The Supreme Court now can decide if the law is legal and follows the Constitution. If they find the law unconstitutional, it can be overturned. Now let's have a brief look at some important healthcare laws that impact the way we receive and manage care. Now, these are some of different healthcare laws or policies that we have here in the United States of America. First, we have the Affordable Care Act. Now, this act helps make healthcare more affordable by providing insurance options, expanding Medicaid, and requiring most people to have health insurance. We also have the COBRA, or Consolidated Omnibus Budget Reconciliation Act. Now, this act lets workers keep their health insurance after losing a job or experiencing life changes such as divorce for a limited time. We also have the Health Information Technology for Economic and Clinical Health Act. This act promotes the use of electronic health records to improve patient care and secure sharing of health information. Of course, we have the Medicare. The Medicare is a federal health insurance program for people aged 65 and older, or those with specific disabilities, covering hospital visits, medical treatments, and prescription drugs. We also have the Occupational Safety and Health Act. This act ensures that workplaces, including healthcare settings, meet safety standards to prevent injuries and protect workers. We also have the Emergency Medical Treatment and Labor Act. This act requires hospitals to treat anyone who comes to the emergency room regardless of their ability to pay, ensuring access to emergency care. We also have the Health Insurance Portability and Accountability Act, or HIPAA. This act protects the privacy of patients by setting rules for how health information should be handled, ensuring it remains confidential and secure. We also have the Food, Drug, and Cosmetic Act. This law oversees the safety of food, drugs, and cosmetics, ensuring products are safe for use and meet health standards set by the FDA. And we also have the Americans with Disabilities Act. This act prevents discrimination against people with disabilities, ensuring equal access to health care and services for those with disabilities. When we talk about health policy, social barriers affecting health can also be areas for health policy. Now, social barriers like lack of affordable housing or limited access to nutritious food can directly contribute to poor health outcomes such as chronic diseases, mental health issues, or higher mortality rates. Health policies aimed at reducing these barriers can ensure that all individuals, regardless of their socioeconomic status, have the resources they need to lead healthier lives. By tackling these social determinants of health, policies can create a more equitable healthcare system and improve the quality of life for underserved population. When it comes to health policy, there are several important issues that can directly affect the quality and availability of the healthcare for everyone. These issues are critical for ensuring that all individuals have access to affordable health care, quality care, no matter their background or where they lived. The first critical issue is access to health care, or increasing insurance coverage and access to care. Ensuring that everyone can get the care they need is a major goal of health policy. and policies that make health insurance more affordable or provide coverage to more people help ensure that individuals don't go without necessary treatment. It could be related to providers. A shortage of doctors and healthcare workers can make it hard for people to get the care they need. Health policies that recruit more providers or ensure they are distributed across communities can help ensure care is available when needed. Another critical issue is public financing. Now, many people rely on government programs like Medicare or Medicaid to afford health care, and policies that provide more funding to these programs ensure that vulnerable groups such as seniors or low-income individuals can access the care they need without financial hardship. Another critical policy issue is access in the elderly. Now, older adults often face challenges like limited mobility or higher healthcare costs. Healthcare policies that expand services for the elderly, such as improving Medicare or providing more community-based care, can make healthcare more accessible for them. Another issue is access in minorities. Minority groups often face barriers to receiving good healthcare due to social and economic factors. Health policies aimed at reducing these inequalities ensure that everyone, regardless of background, can get the care they need. Another critical policy issue is access in rural areas. Now, people living in rural areas often have fewer healthcare options and may need to travel long distances for treatment. Policies that support telemedicines or encourage doctors to work in rural regions can make healthcare more accessible to this community. Another critical policy issue is related to access and low income. Low-income individuals may struggle to afford or access healthcare services. Health policies that offer financial assistance or expand Medicaid can help ensure that everyone, no matter their income, can get the healthcare they need. Another critical policy issue might be related to cost containment or reducing the cost of healthcare. Healthcare can be more expensive for both individuals and governments, and policies that focus on lowering the cost of care, such as regulating prices or promoting preventive care, can help make healthcare more affordable to everyone. And finally, critical policy issue could be related to quality of care or improving health outcomes and patient safety. Now, quality healthcare is not just about having access to services, but also about receiving the best possible care. And policies that focus on improving patient safety, reducing errors, and ensuring high standards can lead to better health outcomes for all. Healthcare administrators and leaders play an essential role in shaping healthcare policy and ensuring that it is effectively put into action. They work in various capacities to influence, manage, and improve the healthcare system for the benefits of patients and communities. So what are the different roles of healthcare leaders in healthcare policy? First is advocate. Healthcare leaders speak up for policies that improve patient care and the overall healthcare system. They use their influence to push for changes that benefit patients, staff, and the community. The second one is a policy developer. Healthcare administrators help create policies that guide how healthcare services are provided. They work on developing rules and guidelines that ensure healthcare is effective, fair, and accessible. The third one is implementer. Once policies are developed, healthcare leaders are responsible for making sure they are carried out. They ensure that the right systems, staff, and resources are in place to put these policies into action. The fourth one is as an evaluator. Healthcare leaders assess how well policies are working by tracking outcomes and gathering feedback. This helps them understand if the policies are achieving their goals or need adjustments. Next, as an educator. They help educate staff, patients, and the community about new policies and practices. This ensures everyone understands the changes and how to follow them for the best health outcomes. Healthcare administrators are also responsible for making sure that policies and practices align with ethical standards. We're talking about ethics guardian. They protect patient rights and ensure that care is provided with respect and dignity. One important role of the healthcare leader in healthcare policy is as a risk manager. Healthcare leaders in healthcare identify and manage potential risk that could harm patients or the organization. They put systems in place to reduce risk and ensure patient safety. And finally, as a collaborator, healthcare leaders work together with other professionals like doctors, nurses, and community leaders to develop and implement policies. Collaboration ensures that everyone's expertise is considered to improve the healthcare system. For this topic, you have a two-part class activity. The first part, classifying healthcare policies. Using the form under the tab in class activity 1, you are expected to review the list of the healthcare policies provided. And for each policy, you're supposed to identify whether it is regulatory or allocative, and you're supposed to submit your completed work through the Canvas. For the second part of your in-class activity, you are supposed to review the areas of access, cost, and quality safety in healthcare policy. And for each area, you're supposed to identify one critical policy issue you believe is most significant. Then, you need to propose a policy solution to address the identified issue at the national, state, or local level. With this assignment, you're supposed to use the provided form under the tab in class activity 2 to record the responses, and you need to submit it through Canvas. Now, just before we end our session, I'm going to present to you the course calendar. We are down to our last few sessions, and next week, December 2, we are expected to have an in-person class wherein we're going to do a brief presentation about our last topic and future of healthcare. But most importantly, during that session, we're going to have a course recap in which we're going to highlight some important topics that we've discussed since week 1. And that is all for today. Happy healthcare, and I hope to see you on the next session. Have a great day.